Namaste. Malaria continues to directly endanger health of over one-third of Nepal's population living in at-risk areas, primarily in remote communities facing poverty and limited access to life-saving health services. Despite Nepal witnessing a nearly 70% decline in malaria cases over the past decade, the road to achieving a malaria-free Nepal remains unfinished as indigenous cases continue to be detected. On World Malaria Day, WHO is calling on countries to accelerate the fight against malaria for a more equitable world. Everyone has the right to quality, timely and affordable services to prevent, detect and treat malaria, yet this is not a reality for all. To reach those most at risk, WHO is urging for sustained investment in malaria control programs, scaled up efforts and more effective implementation of available tools and strategies. Let's accelerate the fight against malaria for a more equitable world through bringing healthcare close to where people live and work through primary healthcare, addressing factors that increase malaria risk, including malaria control interventions in universal health coverage, and engaging communities in health decision making. I also call upon our dedicated health workers to continue their vigilant efforts to ensure no case goes undetected and that early treatment is provided for this preventable disease. I urge the general public to adopt protective measures such as wearing proper attire and using mosquito nets and repellents. I also urge political leaders and all partners concerned to intensify collective efforts for ensuring equitable access to quality malaria services for all at-risk population and engaging local communities in these efforts. WHO will continue to provide support to the Ministry of Health and Population and partners across a range of activities, especially on technical assistance in strengthening malaria, surveillance and response, capacity building for healthcare workers, and fostering multi-sectoral engagement in our pursuit of a malaria-free Nepal. Together, we can and we will make malaria elimination a reality in Nepal.